Hello GutSquad, welcome back to my channel. This is Cecily, as always joined by Freya, our special guest today. She insisted on being in the room with me while I filmed, so here she is. Say hi, Freya. Hi, she won't even say hi. See, cats, guys, cats. Anyway, so today is sort of an update on where I've been, how I'm doing, and also I think like a story time of sorts. So let's start at the beginning of this story, or what I would really consider the beginning of this story. I had sepsis or bacteremia, and that's when bacteria proliferate in the blood, and it's a blood infection essentially. These bacteria were all enteric bacteria, so that means bacteria that come from your bowels some way, somehow, and no one really told me why that happened. There was no evidence of any kind of like bowel perforation that would cause something like that, so the doctors just sort of sent me away saying, hey, I'm sorry, but this was like an idiopathic case of septicemia. We can't figure out what happened to you. As is often the case in medicine, I was kind of okay with that because there's not always like an apparent reason for something happening, right? And I have great doctors, and they really worked hard to try to figure out what was causing the sepsis, but it's resolved now and it's gone, so it's kind of like out of sight, out of mind, I suppose. After I was released from the hospital, I was put on all these IV antibiotics and stuff that I managed at home, and I was feeling better. I was genuinely feeling better. But the only thing that really persisted was this severe pain in my upper GI. I told my doctors about it. I told them that it was also accompanied by extreme nausea, which was making me unable to eat, unable to really tolerate food. They said, okay, well, try to overcome that. Here are some nausea medications that might help you. And they didn't. The problem got worse and worse and worse over the weeks. I asked my gastroenterologist, like, hey, so what should I be doing for this pain? Because it's getting in the way of my life. So he gave me an antispasmodic called hyoscyamine, and he also gave me a CT, outpatient, because it was in the midst of the initial COVID hysteria, which was well placed. COVID's a very terrifying thing, and for people like me with underlying health conditions, it can become deadly very quickly. So I was really cautious about COVID. I did not want to go into the ER. I went to this outpatient radiological clinic and I got the CT scan. Nothing came from it. I went home feeling like, okay, this is probably manageable outpatient since there's nothing surgical that needs to happen. Like, thank God, right? I was taking over-the-counter NSAIDs and they weren't helping, so I switched to an NSAID called ketorolac or Toradol, which is by prescription only, and it was to kind of help for a few days with the pain. You're not supposed to take it consecutively for too long though, because it will damage your kidneys. So I was getting to the point where I was actually like doubling over in pain. You know, when your pain is so bad that you just have to yell. It was that level. Over the weeks, it kind of went from like a 3 to like a 5 to like a 7 to like an 8. So things were getting really bad. In addition to that, my stools were becoming like more black and tarry, and I was vomiting, and there was blood in the vomit from time to time. I thought, this is significant. There's something wrong. And I didn't want to push back on my doctors who kept saying that things were okay, because I'm not a doctor, I'm not a physician, so I trust them implicitly, but I knew something was up. 2 weekends ago, I went into the ER with severe abdominal pain, which they categorize as like cramping pain, but I would say it was more of like a burning or stabbing. And I also was vomiting profusely. It was really bad. So they gave me some morphine, they gave me some IV Zofran, which did essentially nothing, and they gave me another CT, which again was negative for anything substantial that was wrong with the anatomy of my bowels. They sent me home, and the doctor who released me said, well, hopefully now all the bad juju's gone. Hope not to see you back here. I just remember being so taken aback by that. It was such a like flippant thing to say, but okay, maybe the bad juju was gone. Wrong. The bad juju was absolutely not gone. There was something very wrong. By Tuesday, I was back doubled over in pain, and my home care visiting nurse came and she's like, you don't look so good, Cess. And I'm like, yeah, I don't feel so good. She motivated me to call my gastroenterologist's office and insist on an in-person appointment, because up until then, all of our conversations about the pain had been conducted over the MyChart infrastructure and messaging and basically back and forth emails and phone calls. So we were trying to manage things outpatient, and it just was not working anymore. I went to the hospital for a second time, and I was taken about as seriously as the first time. So they did another imaging study, and it was an x-ray, and nothing came from that either. I looked normal, so I was very pleased about that, because my biggest fear was that it was an obstruction of some kind. That's kind of what it felt like, was this like stabbing pain. My output also slowed down, but they think that that was just because I wasn't eating, and I think that's a really understandable assumption to make. The attending doctor there said, "Do you want to be discharged?" And I said, "No, I'd prefer if you admitted me, only because I am definitely still in pain, and this morphine is only a band-aid. I know it'll come back in full force, and then I'll be home with nothing." She said, "Okay, we'll admit you." So I was admitted to what they call the observation unit. And the observation unit is kind of like the catch-all for the cases that don't really have a place yet. My GI eventually visited me after I insisted that they give me a GI consultation. And it was actually my GI that came, fortunately, because he was the person who was closest to my case. He understood it the best, so they said, "Okay, we'll get your normal GI." He came in and he said essentially what the other doctors said. "There doesn't seem to be a reason for your pain. I don't know what to do for you." So I said, "Okay, that's understandable. I get that there's nothing in the imaging we've done, but is there any way you can conduct an endoscopy?" This pain was coming from about this region. The pain was really centralized right here. So I was able to point to it, right? It was just so obvious to me that something was terribly wrong there. The doctor pushed back on me for a while after I asked for that endoscopy, and he was basically saying that he was unwilling to do it. I kept pushing and I kept begging him to do it. I'll never forget this. He said, "I see that you've tried a number of like Tricyclics and other types of antidepressant type drugs. I've tried these, and the reason I've tried them is because I have severe migraines that kind of come and go. I'm under treatment for them now. They're still pretty bad though, God. Migraines are like the worst." But I told him, "Yeah, I've tried these medications in dosages that were appropriate for migraines. I didn't have very good reactions to them. I did not like those drugs." So I asked him, like, "Can we avoid them? I don't like them very much." And he said, "Have you ever tried an SSRI?" And if you guys don't know, SSRIs are selective serotonin reuptake inhibitors. So these are drugs like Prozac, essentially, that are meant for people with severe depression or people with major anxiety disorder, things like that. They're great drugs for people with psychological issues. I don't have any of those psychological issues though. So I was really perplexed by that, and I was insulted by it, because I even asked my therapist a few weeks ago if he thought that I was a candidate for these drugs, because this wasn't the first time the doctor had brought them up with me. He said, "No, I wouldn't consider you a candidate. You have no diagnosable depression or anxiety. Everyone has anxiety, but not everyone has major anxiety or panic disorder, and I certainly don't have those things." So I told my doctor as much. I said, "Well, I don't feel that I'm appropriate for those drugs, and I am confused as to why you think I need them." And he said something to the effect of, "Sometimes this kind of pain is not anatomically founded." I couldn't help taking that somewhat personally, because they hadn't done the endoscopy yet. They didn't know if there was anything wrong. He was just kind of going straight to the assumption that there was something up here, not down in my belly. That was the problem. I said, "Okay, before we add any new medications to this, let's just try to get an image." I insisted on the endoscopy. We finally got it, and the endoscopy came back with this image of a large ulcer that was in my duodenum. If you guys don't know, duodenum is the first part of the small intestine. So you have the stomach, and then the stomach empties into the small intestine through the duodenum, and there's a sphincter that controls that flow. So the duodenum is really important because it's where a great proportion of your calories, fats, carbohydrates, nutrients are absorbed from your food. And it's also where things like the pancreas and the gallbladder and the liver connect to the bowel. It's a really seriously important area. Basically, if you don't treat ulcers like mine, which was moderately sized according to the radiology report, they can become so bad that they actually cause a perforation in the bowel, which can be deadly. Again, you're talking about things like sepsis. You're talking about things like exposure of internal organs, vital internal organs like the pancreas and the liver, to bowel juices, which are very acidic. Yes, it's a huge problem, but it's easy to treat. You are given something called sucralfate, which helps basically coat and heal the ulcer, kind of like burn cream. And then you're also given usually antibiotics, because of one of the primary causes of ulcers is a bacteria called H. pylori. I came back negative for that. Unfortunately, so the antibiotics, I'm still on them because I started the course. When the endoscopy report came back and I was positive for an ulcer, the gastroenterologist visited me again, and he said something along the lines of, well, I'm glad we found it. And I said, yes, I'm very glad that we did the endoscopy. Thank you for doing that for me. And he said, your use of NSAIDs is really the problem here. And he accused me of overtaking Toradol, which is a medication that I'm given for my migraines. I have never overtaken an NSAID, never even come close to overtaking my Toradol. He weeks ago had told me that it was okay and appropriate for me to be taking NSAIDs to help with the pain, because NSAIDs, being anti-inflammatory, are great for bowels, unless you have an ulcer. So of course, we stopped the NSAIDs and we stopped all of the IV Toradol, and we put an end to that. But he was accusing me in no unclear terms of misusing my medicine. So within the course of about 2 days, he initially accused me of over-exaggerating my pain and saying that it was probably a psychological disorder more than an anatomical problem. And he also accused me of overtaking a medication, which I never have overtaken. Whew. So I was really frustrated by that. Nevertheless, I kept my cool as much as I could, and I asked him, like, okay, listen, I just need treatment for this ulcer and I'd love to go home. The ulcer started to improve, I assume, because my nausea started going away, the pain started getting much better, I no longer needed like the narcotics to kind of get through it, and I asked them to stop all of that, and I said, okay, can I just please go home and manage this outpatient, because the more time I spent in the hospital, the more time I felt unbelieved by the doctors. The reason I went into detail about my exchanges with the doctors and my, what would you call it, disillusionment with the medical system is because I know that this is not a unique problem. I know that my GutSquad members out there who are strong advocates for themselves and have educated themselves on their disorder, and they know what causes it. Crohn's, UC, these are pathologies that have an empirical basis in an anatomical problem, and yet they may still be passed off as neurotic, anxious, have stereotypes made against them purely based on, I guess, human folly. So it was an eye-opening situation, and it was actually a fortunate eye-opening situation because I came out of it okay. There was no permanent intestinal damage that I'm aware of, and I'll heal from this with time. It'll take a few weeks. I'm still in pain right now, and that's why I haven't really been filming since I got back, because the pain's not like magically gone. It's still there, but it's significantly less. I've thrown up 5 times since I was discharged, so clearly the nausea is still present, but it's not as bad as it was, so my situation is getting better by the day. What I think was so alarming about this, though, was how hard we had to push for a simple test that people get performed prophylactically. I mean, endoscopies are something that are done for people with gastric reflux and other issues like mine all the time. I haven't had an endoscopy since I was in high school, so it was more than reasonable to ask for one, and yet I was treated like I was asking for something totally outside the realm of what the medical infrastructure was willing to offer me, right? And my refusal of the SSRIs was something that the doctor did not take kindly to. My story, and the stories of so many other people that I've read about who have similar interchanges with doctors that are kind of adversarial to no fault of their own, I think these stories can be really illuminating, and I think these stories can help motivate patients to say, I'm in pain, can we do something about this? It is so within your right as a patient to ask for help. I realize that not every patient has the time to sit there and beg, and that's why some patients don't get the treatment that they need. I realize a lot of patients don't have the money and don't have the access to healthcare that they deserve and that they need. It is frustrating for them because they feel like there's a monetary wall in the way of their health or their children's health or a family member's health. It's a terrifying, paralyzing feeling. And I'm just here to tell you guys that I'm with you. I feel the same way. I have great insurance and a hospital that's world renowned right down the street from me. And yet, even then, it was so difficult for me to claw my way into a testing room. I'm a student. My schedule is very flexible at the moment because I'm on a leave of absence from college due to all of my surgeries and my sepsis. It is easy for me to push. It's easy for this to be my job, to keep myself alive. My mom says that all the time. Sess, your job right now is to keep yourself alive. So that's my job right now. I mean, I have other things that I do, of course, but I don't have the kind of burden that other people do. No health insurance, a job that's demanding and doesn't let them take 3 days off to argue with doctors. This is not an attack on any specific doctor. This is not an attack on the hospital necessarily. All I'm trying to do is build a case for why it's so important to advocate for yourself as a patient, because sometimes that medical system that we trust and that we're told is there for us is not always on the right side of things. Helping patients is what doctors and nurses are trained to do, and sometimes I feel like the system makes it such that it's hard for those individuals who have really good and noble callings to the profession of medicine. It makes it hard for them to do so. I just hope that my story is somewhat relatable to you guys, not because I hope that you've been through similar situations, but because I know you have. If you're watching this, I know that you've probably experienced something like a family member or a friend even having a medical situation that was not treated appropriately because they weren't fundamentally believed. I assume that it's something that happens all over the world. I don't know. I've never had medical care in another country than the United States, but I certainly hope that people in other countries as well as my own learn to advocate for themselves and not take no for an answer and not take an antidepressant for an answer when you have localized pain in your abdomen or your foot or your leg or your eye. These drugs are meant for people who need psychiatric help, and a psychiatrist should be the type of person who diagnoses the need for those drugs and who prescribes them. I don't see why an emergency room visit would be enough to qualify you for an SSRI. I just don't. Hearing from the doctors, stop being so anxious, stop being so dramatic, stop being so hysterical. That term was used. I know you guys already know my position on those words. They're damaging to people because they make people feel unbelieved and they make people less willing to come back. And I was very unwilling to go back to the ER. I did not want to go. It took hell and high water. My boyfriend, my mom, my dad, my nurse, they were all begging me, Cecily, please go back to the hospital. You could die. We don't know what's wrong with you. And I kept saying, no, 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 no. They treat me like dirt. I don't want to go back. I don't trust them. What if they make the problem worse somehow? My message to you guys is advocate for yourselves. It's never too late to say, hey, I don't think that I've been treated right. Let me go back and ask for a better doctor, a different doctor, a new treatment, a new test, a new blood test, a new anything. It is within your right to educate yourself on what's wrong with you, take a doctor's advice, listen to it, and if they are not getting you a result that leads to less pain or a better life, go find a different doctor, because that's what I eventually had to ask for. I hope that my story wasn't too negative for you. I'm sorry it turned into a bit of a rant, and of course I'd like to just stipulate that Dr. Google is not enough to be educated on your problem. I've been educated on my problem by, yes, looking up my problem and researching it, but also by asking specialists and clinicians, can you explain to me the etiology of it? Can you explain to me the pathology of it? Can you explain to me why this is happening? They usually are willing to offer you that kind of information. It's up to you to internalize it, take it, and say, I know the difference between having a bad day or being anxious about something and having a stabbing, horrible, gnawing pain in my stomach that's making me vomit. This is not to put down anyone who does suffer from anxiety or panic disorders. I really hope that that's not what this is taken as. Drugs that affect the nervous system and serotonin receptors and things like that are so helpful to people with severe mental issue, even moderate mental issues. It can be very helpful for them. But it's not a cure-all, and it won't fix a gut problem. If If I had just gone out of the hospital happily with the SSRIs and continued taking my over-the-counter NSAIDs, I could have very easily had a bowel perforation from me not treating it appropriately, but really, it comes down to me. If I hadn't advocated for myself, then I would be in the wrong. Next time something horrible happens, it won't be quite as scary, I hope, and it won't be quite as adversarial, I hope. I mean, I actually had arguments with doctors, which was very uncomfortable for me because in general, I'm a really agreeable person, and I don't like having to confront people when I'm at my lowest. I felt every day like I woke up in that bed like, okay, I need to fight again. I need to fight to get this fixed. I need to fight to not be put on the wrong meds. I'm not a doctor. I'm not a nurse. I'm not a PA. I'm not trained in any way. The only way I'm trained is in being a patient at this point, because it's become my life's work to keep myself going and to keep myself treated and to keep myself alive. That is, in my opinion, my ultimate calling, because life has made it difficult to survive sometimes. Episodes like volvulus and ileus can be deadly. They're severe enough to make you feel like you're on death's door. And I've been there a number of times now, and I feel unbelieved. I go into the hospital under the assumption of guilt, and I think that's such a backwards way to look at things. I really appreciate all of your kind comments and all of your kind words and encouragement over things like Instagram. Thank you all for following me there if you do, because it's usually where I keep you up to date if something like horribly wrong is happening, and I don't really have time to like sit down or the energy to sit down and film a video about it. I'm moving next week, so things are really hectic in my neck of the woods. So I'm probably gonna take a few weeks to like get back to a normal editing and videography schedule, but I hope that in that time you guys follow me on Instagram, you guys like, comment, subscribe, check out my other videos, all that jazz. So sorry, little one. Freya says goodbye. She says thank you guys so much for watching, Mama. She was worried about me while I was in the hospital. She was a really good girl. Daddy took very good care of her. My boyfriend was excellent with the cats. I will see you in my next video, and as always, stay safe out there, Gut Squad. Bye!